Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to the Canine Culture Podcast. This is your host, Brittany, and today we're talking about laser therapy for dogs. This is one of my favorite topics, and so I had to have Dr. Laurie McCauley back on to talk about this because she is a pioneer in the field. So, Dr. McCauley, thank you for joining us.
Thanks for having me. I'm so excited. I'm so passionate about, there's so much research behind laser, and the more I can teach people that they can help their pets or their patients, right? The better it helps me. It fills my cup. So thank you for having me.
Of course. So a little bit of background here. I have been getting laser therapy on my senior palms for years. I started in, it would have been like 2017, and no one was doing it. We had one vet practice in town. And so over time, that's kind of grown. More and more vets were offering it. And then earlier this year, I took Dr. McCauley's course on laser therapy for dogs. Learned so much, like from the anatomy of the dogs to how to think about bone versus tissue versus muscle. And so I myself now have a laser, and I have been loving it. This is not medical advice, but I've used it on myself, and it has been great as well. So we're going to get into laser therapy. So let's talk about first, because some people still don't know, what is laser therapy for dogs in simple terms?
So laser is light energy, but it's really specific. So in order to be considered laser, it has to be monochromic, meaning one color, so one wavelength. It has to be collimated, which means the energy is coming straight. It's not converging or diverging. And it has to be coherent, which means all of the little photons move together. And that and have enough power to actually penetrate the tissue. And when you put all of that together, you can literally take that energy inches into the tissue to have a physiologic effect.
So tell us how it works, because I think some people hear laser and they think like red light therapy, which is kind of trendy right now, right? Or they think about different like lights that you might have on. And, there's people doing different kind of like light therapies, right? So I think there's a misunderstanding about how it ultimately works in the body.
Yeah, so if we think about it, if you have a lot of power, if you have high energy going into the tissue, you can actually shut down the mitochondria. So if you think about the cell, inside the cell you have the mitochondria, which makes ATP. And the membrane around that mitochondria has a whole bunch of substances that create that ATP. And if you have high doses of energy coming in, it shuts that down. And you say, well, that would be a bad thing. Well, except when it's a nerve and it's sending pain impulses to the brain. So with higher doses of energy, we get what we call an axonal, meaning the axon of the nerve block. So you're literally shutting down the ability of that nerve cell to send pain impulses to the brain. On the other hand, if we use lower doses, we can actually speed up that membrane so that the mitochondria can put out a lot more ATP, which is the energy for the cell, and the cell can do whatever it needs to do, whether it be creating more substances or growing. And it also has been shown to increase blood vessel diameter. So you have vasodilation, so more blood flow can come to the tissue. You can increase low doses increase fibroblasts, which are the cells that like heal things. Now at high doses, we're getting rid of the pain a lot better, but it actually stops those fibroblasts from coming in. So you have to balance. So you are always thinking about, what's my goal? Is my goal, oh my God, the dog's in a lot of pain, or cat or horse or whatever, and I'm going to use a higher dose knowing that I may not have as much healing, or I'm going to drop my dose down and significantly speed my healing, but it might not quite have as much of a pain response.
Right.
So we're always playing with that to get optimum effect.
And there's different types of lasers. And so I think I already mentioned I have a class 3. And, when I mention it to people, even my PT friends who are human PTs, they're like, wait, what are you talking about? Class 3, class 4. And those are the two we're going to focus on. So tell us about the different types of lasers. We can talk about class 3, class 4, and kind of like what their differences are.
Great. So the government has decided that they are going to put laser into class, not by how much it's going to heal, but by how much damage it can do to your eye. So a class 3B laser, which is what a lot of the healing lasers are, means that if you have extended exposure or small amounts of exposure, it can actually cause blindness, right? So OSHA says that if you're using a 3B laser, they recommend you wearing safety goggles or protection glasses. If you're in a class 4, it's, oh my gosh, if it accidentally comes up, it's going to damage your eye. OSHA requires you to have, it's 100% required that you have to have glasses. Now, OSHA is worried about people. They don't really care about animals.
Right.
In my hands, everybody, whether you're using a class 3 or class 4 laser, should have eye protection on. And for the animals that are like, no, I can't handle that, we put a thick towel over their head. Obviously, the nose and mouth are out so they can breathe,
Right.
but it's protecting their eyes. So that's one big thing. The other thing to realize is it depends upon the wavelength, what class you need. So if you have something in like the 600 range, which is your red, it's not going to have a lot of penetration, but it's not going to do a lot of damage. So it's amazing for skin because you're not going to get the saturation into the tissue, and you don't need a lot of energy, right? Which is why a lot of your red light therapies and stuff like that are out there, because you don't need a lot of energy when you're using red. Then you have things like the laser you're using, which is an 810. So something in the 800 range, and it's like from 808 to 865, that has a ton of healing potential, and you need a little more energy. Then there's 904, 905, which has the best penetration, and you need the least amount of energy. And then you have something, if it's in the 970, 980, that's absorbed a lot by water. So you need a lot more energy. And that's why those lasers have to be a heating class 4 laser. Because literally it's heating because the energy comes into the tissue, it's absorbed by water, so it doesn't have the penetration. So you have to saturate the tissue to get the penetration you need if you want to go deep, which is why you have to keep moving it. So class 4 lasers really should only be used by veterinary professionals who are trained in how to use it, never by pet parents, because it does have the ability to, like, the dog kicks it out of your hand, you don't have glasses on, or it can even bounce off a shiny surface and do damage to your eye. So you have to be super careful with them. And it's not that it's bad, right? The class 4 lasers are great,
Right.
but you have to respect it. I always say a laser is like a scalpel. In the right hands, it can do amazing things, and in the wrong hands, it can do damage.
I've also heard people say with class 4, like it can get just so hot to the touch that if used by someone who is not a professional, I mean, you could technically do damage to like a tendon or a ligament.
Huge. I've had clients say that they had somebody use a class 4 laser that wasn't, it's not the laser's fault. It is the person using it, where they smelt their dog's hair singe.
Wow.
Right? I've seen where somebody has been doing it and started talking and stopped moving a high power class 4 and literally caused ulcers and burns on the tissue.
Wow.
I've used them. I literally have like 10 lasers in my house because I love them and play with them. And if you get too much energy into an area, it actually aches, right?
Oh.
So you need to know what you're doing so that you put the right amount of energy in there. The other thing to realize is when we talk about classes besides the eyes is it's related to power. So over 500 milliwatts is considered class 4 for a single diode, right? Because that's the energy that's coming out of that diode. Under 500 milliwatts would be your 3Bs.
Mm-hmm.
And that's a super, super important thing to think about because there's so much false advertisement where they say it's
Yeah.
a class 4 laser, it's got 750 milliwatts, right? But it's 10 diodes.
Right.
Means it's like 75 milliwatts. So it's a very low power 3B.
Yeah, I think right now the advertising on lasers,
Horrible.
because a lot of it is getting really popular, even back to like the red light that we were talking about, like even for humans, you're seeing just junk, just literally LEDs that are like red that people are buying and spending all this money on, and they're not worth anything. And the same for the pet industry. I mean, you see on Amazon these like little lasers that are 30, $40, and they're like, they fix your pet's inflammation. They'll take no more meds. And it's like, that's just a colored light. Like, that's not
Right.
going to work.
Right. Right. No, I mean, I hope it's okay if I name one
Yeah.
because I am so frustrated. I've had so many people say, "Oh, I've seen these advertisements for Helio." I'm like, let's think about this honestly. If they say that you should use the same amount of energy, which is what's on their recommendations for skin, superficial, and hips, the deepest penetration you need, and a
Right.
different amount of energy for knees, which should be somewhere in the middle, something's not right there. And if they can't tell you how much power there is per diode, right? There's just so much false information.
Yeah.
It's really sad.
Yeah. Yeah. So my class 3 is from Spectra Vet, and they were so great to work with. I said, I took a course. I still feel really new. I need a little bit of help. Here are my dogs. Here are my goals. And they were able to guide me. Like, they not only gave me all of the literature, to which I was like, as an attorney, I should read this, but I'm going to let you guys give me a little brief. They ultimately were like, here's the cliff notes, and here's what you probably want. And it was super easy to do. The laser that I have, I mean, it's pretty compact.
Hmm.
You can charge it and like have it be wireless, which is really, really nice.
Yeah.
And it came with glasses for me.
Hmm.
Um, the boys won't wear goggles, so they have to just have their face covered because, dogs hate goggles usually, unless they're trained to wear them. But it's really, really simple for me to use it. And we'll talk about this in a second. You and I talked off air once. I was trying to use it and get double the benefit while doing it on a PEMF mat, to which I
Mm.
learned is a no-go. And we'll talk about that in a second. I don't want to jump ahead. But I just learned so much. And so I think other pet parents can learn a lot from these lasers because it can sound scary, right? It can sound
Mhm.
really scary to talk about these lasers. Conceptually, though, if you break it down, you take the right courses, you get educated, it's
Mhm.
something that you can do and it doesn't replace your vet. It
Right.
could be a filler or a fill in or an add on because it's just so hard sometimes to get to the vet, especially during the work week, the cost of going, the time commitment. And so I know for us, it's a time saver for sure.
Well, and you and I were just talking off air about how getting into your vet right now, one of the pups can't see him until June, right? And
Hmm.
we're in April,
Yeah.
right?
Yeah.
So that definitely, I mean that, and if you said, okay, well, if we're just starting and we wanted to treat twice a week, even,
Right.
right? And you can't get in until June for one appointment, this gives you, I mean, it's really good healthcare.
Yeah.
And is
Yeah.
it expensive? A good laser? Absolutely, it's expensive.
Hmm.
But you figure it, if you take the Optimum Pet Vitality course, you get 10% off the laser,
Hmm.
which more than pays for the course.
Right.
And then with that, it takes about, I think I figured out about 60 treatments, depending upon where you live, to pay off the laser. But if you're doing one dog twice a week, that's 6 months.
Right.
And then if you've got multiple dogs, or if you're treating yourself, or if
Hmm.
you're right, your cat, your horse, whatever, it pays itself off. And then you're literally saving a ton of money because you're
Yeah.
not going to the vet. And you're going to be more likely to do it because
Yeah.
don't wait until you're screaming in pain, right? Let's do
Hmm.
it either proactively when there's small problems,
Right.
or if you're like, hey, you know what? My dog has bad hips. let's laser it so we don't have the inflammation that's going to cause the arthritis, rather
Right.
than waiting to get rid of the pain once they have the arthritis.
Yeah. I think that's the perfect segue into the top uses for laser therapy. There's so many things you could use it for. But what are, would you say, the top three conditions that you would use laser for?
Certainly pain, whether it be my dog had an injury, my dog had surgery, my dog has osteoarthritis, which we know is so friggin' common, right?
Hmm.
That where they say 20% of dogs over a year and 80% of dogs over 8
Yeah.
have arthritis. So and think about this, pay now, pay later, right? So you can pay later when they have the arthritis and they're painful and they're on drugs, and then you have to give them other things because of the side effects of the drugs. And again, I am all about better living through chemistry when needed. But
Right.
if we can do something that helps heal rather than giving drugs that may have side effects,
Hmm.
right? That's to me is always better. So let's be more on the treat early
Right.
and prevent the problems, and then you don't
Right.
have to use the drugs.
Yeah.
So pain is a big one. The other, speed and healing, right? So we know from research that wounds, burns, tendon and ligament injuries, all of those heal in about half the time if laser's used.
Hmm.
So healing's super important. And then honestly, because I treat so many patients who have degenerative changes, whether it be arthritis, or, I mean, it can even be kidney disease, liver disease, anything like that. We know from the research that if we laser the ilium, so the pelvis and the inside of the tibias, the top of the, just below the knee, that
Hmm.
we can release stem cells. So again, can you do it with surgery? Absolutely. You can take that fat, that mesenchymal tissue, and culture it and have beautiful stem cells. You could draw blood and have protein-rich plasma. But if I
Hmm.
can non-invasively, and especially if you're doing it at home, right?
Yeah.
Laser the pelvis and the just below the knees, and I get stem cell release into the body, and it goes wherever it needs to. That's awesome. Can I tell the story of the research? Because I just
Yeah.
think it's so cool.
Yeah.
So they took a bunch of pigs and they cut open all the bones and they said, where's the most stem cells? And they found the ilium and the tibias, the top of the tibia. And then they took a bunch of pigs and they caused a heart attack. And then of those pigs, half of them they did nothing, and half of them they lasered not every day, not of the heart. They lasered on just day 2 and day 7 post heart attack, and they only lasered the iliums and the tibias. And then on day 10, they drew blood samples from all the pigs, and they said, wow, look, there's a lot more circulating stem cells. This is really cool. And they isolated a whole bunch of different proteins and things. And then at day 90, they euthanized all the pigs and they measured the size of the infarct or the damage to the heart. And on average, it was 68% smaller after 2 laser treatments at day 2 and day 7. Again, not even of the heart, just of the places that they knew that were going to release stem cells.
Yeah. And stem cells are expensive. I've done PRP, which is, your own plasma.
Right.
That's even very costly. Insurance doesn't cover it. And after doing it a few times for my knee, I asked about stem cell. I quickly said, never mind when I got that price tag. But I've actually been lasering my knee, and knock on wood, it has felt fine. We're just going to keep going with that. I'm lasering my knee like maybe once a week right now. My knee, a little bit into some shin splints, and it's working for those. And then a little bit on the feet, because last year I was actually going all the way to PT, paying, I don't know, $45 or $55 to get laser. I think it was class
Mhm.
4,
Yeah.
mine 3, on my feet, and then drive 30 minutes back home. And it was just such a production and such an expense. Yeah. So I'm focusing on the bottom parts of my legs right now. And I don't know, maybe I'm making more stem cells, right?
Yeah, well, I mean, and now that you know that, right? If
Yeah,
you just happen to laser, and I'm not doing any medical advice at all, but I can just tell you from the research, the
right.
inside of the knee where there's not a lot of muscle, and in the dogs, there's like almost nothing, right?
Hmm.
And so you're getting right to the bone. That's that. And then the part of the pelvis that's up by your hips, right? The top part, that's the wing of your ilium. That's where, and if you think about it, that's where they take bone marrow from if you're going to be like a donor, right? Or they're testing your bone marrow. So it makes
Right.
sense. That's where you have a lot of stem cells.
Yeah. And we
Well,
talked
but
about
hold
how
on,
it,
before you go further, I
yeah.
have to ask. You said your shin splints were better. You said your knees were better. Are your feet better?
My feet are hit or miss.
Hmm.
I have very, very flat feet and I'm very hypermobile and it creates problems.
Hmm.
So I'm going to say, you know what? The feet are a lot better. They're not perfect, but they are a lot better. And so maybe that's a caveat I should say. Laser won't fix your entire life. I've tried. I think you got to do other things, but it
Yes.
will help, right? And so it'll
Right.
help. So it is helping. It's just one of those things. Sometimes we get in our head for ourselves or for our pets. We're like, this is it. This is the miracle. This will work. And that could be a modality. That could be a drug. That could be even a new bed. You're like, I got my dog this new bed. They're going to have no more arthritis. And it's like, realistically, no. It'll help them, 10% feel better. So I'm checking my expectations here. It's helping. I'm just not 100%. I probably never will be. Um, I also just will run my feet and body into the ground doing endurance training. And so I'm probably not helping my case.
Well, I love that you brought up that it's not a silver bullet, right? It's multimodal therapy is so very important. It's
Yeah.
study after study show that when you bring in multiple things, you have significantly better results.
Yeah. Yeah. And for my dogs, I like to pair it with acupuncture, with different PT, so it doesn't have to be complex. And then things that people don't think about, their diet, because if we're not fixing the heart of the issue, fixing their diet, and some of their supplementation, which, for me, that's even been a growing point, right? Like we kind of learn over the years what works, what doesn't, what's a trend, what's true. That could be a whole other topic.
Yeah, oh,
Um,
absolutely. And think about this. What's amazing for one dog may not help another dog,
True, very true.
right? It's
Yes,
their individual needs.
right.
Yeah,
So there are times that laser therapy is not appropriate.
absolutely.
And let's talk about those. What would those conditions be that you would not do? Conditions or otherwise. They don't have to be a condition where you would not use laser.
So a big one would be cancer, right? Because we don't want to increase blood flow to cancer. We never want to feed a tumor. No, if a dog has cancer on his jaw, can I treat his knee? Absolutely, not a problem at all, right? And have I ever treated a dog with cancer or around the cancer? Absolutely, with informed consent, as palliative care. So I had a patient who came in who had a fist-sized mast cell tumor, and the surgeon took it off, and it was on his chest, on his ribs, and had dirty margins. So they went back in and literally scraped the ribs, and then the dog's arm was like stuck. And they brought him in, and we had said we can't laser, it can come back. And they brought him in one day and said, just so you know, the kids are coming home for Christmas. You can treat him, and it's going to be the last time you're going to see him. And I said, whoa, 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 before we do that, let's try laser, right?
Right.
Because literally the skin was attached to the body wall. The dog couldn't walk really well. Its leg was stuck to its chest.
Mm.
We had 9 more months of quality life
Wow.
with that dog, right?
Wow.
So we had one more surgery. So I think it was like 6 months in, they started to grow, and he had 3 little tumors. So they took those off. And then 3 months later, they started to grow again, and they're like, okay, that's enough.
Yeah.
But the dog had 9 more months of quality life,
Wow.
right? So
Yeah.
yes, it's a contraindication, and you can make decisions around it.
Yeah.
Another big one is tattoos. And you say, well, that's people, not dogs, except a lot of dogs will get a tattoo when they're spayed or neutered. So the ink absorbs the energy and makes it hot really fast. So you can burn them. So you don't want to do that. Another big one is if you give an injection, you don't want to laser over, especially with a class 4 or anything that heats. Because we don't know if one, if it's going to change the absorption of that material, or two, if it's going to change the material itself.
Right.
Whether it be the heat or the energy can literally change the molecules. And then obviously around the eyes, right? Anything, you wouldn't want to do the corneas. And again, it's a caveat, right? So your red LEDs and very low power can be used amazing to heal corneal ulcers,
Right.
right? But again, you have to know what you're doing
Yeah.
because you can literally blind the animal if you're doing the wrong set of variables.
And let's bump into frequency and treatment plans. So it's a little different for every dog, but how often should a dog receive laser therapy?
So if you're going to your vet, they will probably tell you twice a week, right? Maybe they'll say 3 times a week to start. In reality, because I had a huge rehab clinic in Chicago, a lot of our like paralyzed dogs, or they say they had an amputation or a thoracotomy where you're going into their chest and there's a lot of pain. We would do it once a day and on some occasions even twice a day to start.
Wow.
So again, okay, so you talked about treating yourself. So I can tell you, when my son had all 4 wisdom teeth out, we did it twice a day for 3 days. And by day 3, he was 18. I shook him by the shoulders and I said, "You're supposed to be in bed sleeping." And he went bridge jumping because he was living in Florida at the time.
Uh-huh.
And I'm like, "Dirty water, wisdom teeth out. What are you thinking?" He had no pain.
Yeah.
Right? He had his wisdom teeth out. He started to swell. We lasered him. The swelling went away and it never came back. And he'd be like, "Hey mom, has it been 12 hours? Can we do it again?" We'd do it. And then the pain was gone.
Yeah.
Same kid when he was younger had his tonsils out. And the surgical nurse said, "We have never seen tonsils that big before." And they went in and they started to bring him up and he started to bleed. So they had to put him under again and cauterize it. So a lot of like iatrogenic damage, right, from the cautery. And what I learned was if you have a sore throat or you want a laser, when we did it here, it helped a little. And when we went through his mouth to aim right at that tissue, all of the pain was gone.
Oh, interesting.
Yeah. So in those kind of cases, start out twice a day for like 3 days.
Yeah.
My dogs that would come in, I had a neurologist when I was in Chicago that would be like, "Laurie, they're coming to your clinic now," right? So they would have their surgery and the next day they were being released and they would send them right to us. And we would laser those guys twice a day for a couple days. But your normal vet, like you said, you can't get into June for laser, right? So
Right.
they can't even offer you that, right? So it may be a couple times a week, maybe once a week. It's what you can do, what they can do. And that's why I think lasering at home, if you have a machine and you have the education to know what to do, because one of the big things we teach in there is probe placement and body position.
Yeah.
Huge. Can we go into that for just a second?
Yeah, yeah, for sure.
So think about this. If I were to laser my wrist like this, how do I get to the cartilage? It has to go through bone to get to the cartilage. If I flex my wrist, I have then taken this joint that looks like this and done this. Now that energy can come in and actually affect the cartilage and the stretched joint capsule to have a much more significant effect. Right? So, and then knowing which way to point the laser to get the most effect makes a huge difference as well. So if you don't know what you're doing, you can have an effect. But if you know what you're doing, you can have an amazing effect.
Right. That's what I took away from the course for the placement. Like for knees, if I'm trying to get kind of in the knee itself, I want it kind of on this bend, right? To get it in there versus just dead on where it's like, well, I'm just hitting the bone at that point,
Right.
I'm
You have
right
to
on
go
the
through
patella,
bone.
whereas I'm trying to go more for like the tendons or the ligaments or so that was helpful for me to learn because you just kind of think anatomically, you're like, okay, knee,
Right.
You're not thinking like capsule placement or where that energy is being directed or what it has to go through. Yeah, so that's super helpful. And then this is also different, but how quickly would you say most people see results in their dogs?
So depending upon the machine, right? So you may see, I've had people say, if you don't see change within 4 to 6 treatments, that modality, no matter what it is, acupuncture, chiropractic, laser, may not help.
Yeah.
In my hands, with the lasers that I use, I usually have immediate effects. And the only time it's not immediate is realizing when you are treating the body and you're decreasing the inflammation. So we can talk about if you have a joint. So say we're dealing with arthritis, literally by lasering the joint capsule, the cells that create the inflammation live just on the inside of that joint capsule. And they shut off creating those inflammatory mediators. So it takes up to 15 minutes for that joint to equilibrate and have an effect. So like all the time, I see dogs that have inflammation or a fusion in their knees. So instead of it being a concave joint capsule, it's convex or flat. And literally by the time we get done lasering the dog, it's concave again. So it may take 15 minutes. I've had a dog come in that had what would be in the human an Achilles tendon. It's a common calcaneal tendon in the dog. And it was 4 times normal size.
Yeah.
And we got the
injury.
swelling down 50% within 8 minutes,
Wow.
right? But again, if you have a paralyzed dog, it's not like I'm going to do one laser treatment and they're going to get up and walk, right?
Right.
It can take time in cases like that. So it depends a little bit. But most of the time, I see a change within the first one treatment. And certainly if you're doing like 4 to 6 treatments and you're not getting an effect, then it's time to change modalities.
Right. And speaking of modalities, what are some things you like to pair with the laser? I know I mentioned a few of mine. What are some of your top modalities you would pair?
I love PEMF, pulse electromagnetic field therapy. So Respond has a bed, a CC has a bed, a CC has a loop. The one thing to know about that is that we talk about MOA, mode of action, and the laser has a bunch of different modes of action, and PEMF has a bunch of different modes of action, but they both work on the inflammatory cascade, the nitrous oxide cascade. So when you treat with either PEMF or laser, you turn that cascade on, and it takes about 2 hours to go through that whole cascade. So if you do both at the same time, you have 2 hours of that cascade. Whereas if you do one and then 2 hours later do the other, you have 4 hours of that cascade, and you're going to have a much better effect. So I love laser and PEMF, and I love them separated by at least 2 hours. Acupuncture, right? We talked about little red lights, right? So if you had like a laser pointer and you wanted to put it on an acupuncture point and hold it for a couple minutes, right?
Yeah.
Very tiny amount of energy, but you don't need a lot of energy if you're stimulating an acupuncture point. Is it ever going to have as much effect as a needle? No, but it can have an effect, right? Acupuncture is amazing. Chiropractic or manual therapy, osteopathy is amazing. Exercise, right? Because we want to get rid of the pain and then strengthen all the tissue around it so that we don't have another injury or we prevent injuries. Massage is wonderful. Shockwave is coming out. It was becoming more and more popular.
Some shockwave stuff. And you and I might talk about shockwave later because I have questions another day, but that is coming out and I've been seeing it and I'm like, let me get my hands on this.
Yeah, yeah.
We'll save it.
Yep. And the underwater treadmill, right?
Yeah.
Which is a beautiful way to exercise and to help heal the tissue.
If anyone follows Canine Culture Podcast on Instagram, I have posted my oldest dog doing the underwater treadmill, and he barks and hops at the same time, and he barks the whole time he's in there because he doesn't want the walls up, so he's like, put the walls down. But he loves doing the treadmill. So when he was going to therapy twice a week, he got it ingrained in his mind that every time we touched our keys, he was going to therapy. And so he would run to the door and get ready. He loves the underwater treadmill. If I could get one at my house, it'd be game over. He would be in that 20 hours a day. He'd be a marathoner for sure.
Yeah. Oh, yeah. They love it. Well, and it feels good, right? Warm water. You have buoyancy. You have hydrostatic pressure, so it decreases inflammation. It increases blood flow. It has resistance. The faster you go, the more resistance you have. So
Right.
you can turn up the speed or add jets, and it can be safe for a 16-year-old dog that has really bad arthritis, and an amazing for an athlete as well.
Yeah. And I feel like I'm going to say I know. Doing a lot of these modalities will reduce your need for medications. Wouldn't you agree?
100%.
Yeah.
100%. So, to give you an idea, we talked about PEMF. I'm a research nerd, and Assisi did a research project that was published where they had, oh, which one was it? Previcox. It was 3 weeks of Previcox or 3 weeks of twice a day Assisi loop.
Mm.
And in those 3 weeks, both groups did really well. But then they took it away. And what they found was that within 7 to 10 days, the dogs that were on the drugs started to have problems again. And the dogs that had the Assisi loop, the PEMF, actually were better, still significantly better at both 4 and 12 months after the session stopped. So it's not just about decreasing inflammation right now, it's
Yeah.
about modifying the tissue. So you're getting rid of the pain, not because you're just increasing the inflammation, but you're healing the tissue. So
Right.
you have long-term effects. And it's the same with laser.
Yeah. And I was going to say probably the same for humans. Taking an ibuprofen is pretty different from engaging in one like a laser therapy, a PEMF. So kind of the same concept that I don't think we think about often. So let's talk about a laser therapy session and what should a dog owner expect? What should it look like?
So, and things that are really important is the dog should be comfortable, right? It should be something where they're getting this therapy, and they may be like, "Oh, I don't want the glasses on," right? But it shouldn't be like, "Hey, hey, hey, I don't like that."
Right.
They should relax. It should make them feel good. Trigger points should go away. Inflammation should go away. It should never be. You should never smell, like we just said, right? Things burning.
Hmm.
They should, some dogs will hear that beep, beep, right? So
Yeah.
legally, you're supposed to have sound on it when it's on,
Mm.
as a protection thing. So some machines you can shut that volume off, some of them you can't. And if the dog is super sensitive, we tell people if you whistle, they hear the whistle and they don't hear the beep. So
Mm.
that can help with that. Um, they should feel better.
Yeah. And whenever you're looking for a provider and or you want to provide therapy within your own or laser therapy within your own home, what are some things we're looking for?
Say that again.
Whenever
Sorry.
you're choosing a qualified
Oh,
provider
okay.
for
Yeah,
laser
yeah, yeah.
therapy, or if maybe you don't have access to a provider, maybe the drive would be too long, the timing would be too long, and you want to offer it yourself. What would that look like? What would you look for?
Education, right? So veterinarians and veterinary technicians can be rehab certified. They can have had rehab classes or laser classes. Optimum Pet Vitality, my company, has a 20-hour course that is race approved for veterinarians and technicians, and we've had over 1,000 people go through it. So that teaches them everything they need to know about laser. If you're
Hmm.
doing it at home, then again, we have at-home laser therapy, which is a course that goes through all the joints so that it teaches you the probe positioning, the why, the how, the body positioning, all of that for multiple different types of lasers.
Hmm. And so, what's the one thing you want to leave dog owners with? What's one thing you want them to understand about laser therapy?
Can I give two? One
Yeah, yeah, you can
is
give two.
one is you can do it at home, right?
Yeah.
It's so helpful, and it
Hmm.
is so healing. And with the right education and the right equipment, it's certainly something you can do at home.
Right.
And then the other piece is you need the right equipment,
Yeah, yeah.
right? It's the cheap ones made in China, the plastic, you don't know if they're broken, you don't know if they're working. They lie to you. I mean, I hate to say it, but they, like we said, the probes, right? If they say it's a class 4 laser, it's 750 milliwatts, but it's 10 different diodes, it's a weak class 3B that, may take 15 minutes for something a laser can do in 30 seconds.
Right.
So that's super important. I'm going to throw one more at you because it's so important. Um, if you're lasering for arthritis, you have to get the joint capsule.
Mm.
Oh, gosh. So, yes, you need to get the joint capsule. There's research that shows that if you don't, the reason that's important is because if you have the right wavelengths, the energy can be absorbed by blood. So actually, I don't even think this is something we talked about.
No.
From reading the research, you can laser like the jugular and carotid so that the blood going to the brain or the blood coming from the brain can absorb the energy and go through the body. So you can do that for overall health. So there's studies, there was a Russian study, kids with asthma that were hospitalized. And half of them had conservative therapy only, and half of them had conservative therapy and laser therapy. And the kids who had the laser therapy got better significantly faster and had, within the next 3 years, had a third less hospital visits.
Wow.
And that was from 5 to 7 treatments. That's it. Just 5 to 7 treatments of the blood. It affected their body long term, right? So there's things we can do. We can laser the brain. There's studies in rodents and humans that can show that it can decrease inflammation and decrease beta amyloid. So, right, so we talk about, there's research going on now about with with Alzheimer's. There's just so much you can do with it.
Yeah. Yeah. So much. We're sitting here thinking like joints and muscles, but you just opened another door. So if people want to learn more, if people do want to take the laser therapy course or check it out to see what it's about, where can they find all of that information?
So the website is optimumpetvitality.com, and the pet parent course is at-home laser therapy. The professional course, if somebody is a professional and like, I want more, which covers not just the joints, but mouth and ears and anal glands and lungs and liver and all of that stuff, is called Optimum Laser Therapy. We also have a booklet. I think Christine sent you a link so that people can get a booklet emailed to them, everything you want to know about laser therapy for your pet.
And that'll be linked in the show notes. So it'll be in the show notes, and we'll link the website, we'll link the social media. It'll all be in the show notes to wherever you're listening. And Dr. McCauley, thank you for coming on. It's always just so much information, and I love it. So I hope that everyone listening learned a lot today too. So we appreciate you.
Thank you. Can I throw one more thing in there because I have to? Because I just learned you got a Dutch Shepherd, and it is so exciting. And there's a ton of research also for athletes. Lasering muscles before activity increases the rate of building strength and endurance.
Okay.
Oh, wait, you're a runner.
I am.
Do we have 2 more minutes that I can tell you a really cool story?
Yeah.
So I had interns for 12 years, right? I've had interns from 17 countries. And I was hanging out with an intern, and I was telling him a story about how they did this study where they had to be college kids, right? So they were 18 to 24-year-old white males, and half of them they did a sham laser, and half of them they did real laser on their calf muscles, and then threw them on a treadmill and said, run as long as you can, and then we're going to take a biopsy of your muscle and your nerve, right? So that's why I said it's got to be college kids, right? What they found was the kids who had the actual real laser ran significantly longer and had significantly less oxidative damage. So I was telling my intern this, and my office manager, who was training for a marathon, after we were done for the day, is like, she wanted to run the Chicago Marathon before she turned 60. So she's like, I'm training. Every Sunday I go for a 20-mile run so that I can train for this. Can I borrow the laser? And at first I'm like, It's a $35,000 laser,
Right.
right? So I said, okay, it's Saturday night. Let's laser you now and see how your run goes tomorrow. The next week she comes back and she's like, well, it was a little bit better. Can I take it home? And I'm like, all right. So she lasered herself in the morning and then she went for her run. And she's like, Laurie, this is amazing. And then the next week comes and she's like, can I take it home again? And I'm like, I'm a scientist. Let's see if it works from last week. And of course, on Monday, she comes in and she's like, I'm really mad at you. She's like, no, it didn't work from last week. And next week is the Chicago Marathon. Can I please take it home? And I'm like, yes, you can. She lasered herself on the way down to the marathon. She had never run more than 20 miles. She ran the full 26 miles with no problem, no pain. She said when she got done, she had a little bit of an ache in her back. She lasered it, and within a minute, the pain was gone, and she was fine. So it is just, for athletes, and there's studies, they did a study with soccer players. And again, it was double-blind, placebo-controlled, and they just monitored when the player fatigues, the coach calls them out and puts somebody else in, right? So they're just watching.
Right.
And they found that the players that had the actual laser, not the sham, their times in the game was significantly longer.
Wow.
Right? So endurance, strength, all of that stuff has been shown. So it's super cool stuff.
Yeah, I'll remember that from me and Kova. We're gonna need it for our runs that we have.
Yeah.
All right, Dr. McCauley, thank you so much for coming on.
Thank you for having me and for giving me a chance to help people learn how to help their pets.
Absolutely. Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.